Seriously ill patients are regularly being turned away from Gold Coast University Hospital because of a shortage of beds in the intensive care unit. Hospital management says they've brought in measures which have helped ease the situation, but doctors say it's not enough.
Kiriyama was 3 years old when he was rushed to Gold Coast Hospital by ambulance after suffering convulsions and shortness of breath caused by an abscess in his mouth.
I said to them then and there, look, this needs to be dealt with. He was in here yesterday. You sent us away.
He was placed on a wait list for maxillofacial surgery. Several appointments and many weeks later, Kiriyama was brought in for his operation, only to be told it couldn't proceed.
I actually cried. I sat there in the doctor's room and bawled my eyes out.
In Kiriyama's case, his family needed a healthcare card, but he's not the only one to be disappointed at the last minute. Documents obtained exclusively by 7 News under Right to Information laws reveal in the first half of last year, 60 patients were turned away and 73 had their operations cancelled because of a lack of resources.
There was a flu epidemic last year and it affected all the intensive care units in the entire southeast corner, and there was actually a shortage of intensive care beds.
Dr Bailey, who's in charge of surgical and specialist procedures, says in the past 4 months, only 20 operations had to be rescheduled.
We're not turning patients away from critical care at the moment.
Gold Coast now has 5 extra intensive care beds, bringing the number up to 22. But doctors say it's still not enough.
There's probably a greater demand for more ICU beds to come online, and the timing for that needs to be done as soon as would be reasonably possible.
Health Minister Cameron Dix says in the latest budget, funding for the Gold Coast Health Service increased by 12%. But Atahua won't risk it again.
Make sure you have private health insurance.
Alison Sandy, 7 News.